So if we look at California, these numbers are from yesterday. We have 33,865 COVID cases out of a total of 280,900 total tested. That's 12% of Californians were positive for COVID. So we don't, as you guys know, the initial models were woefully inaccurate. They predicted millions of cases of death, not of prevalence or incidence, but death. That is not materializing. What is materializing in the state of California is 12% positives. Well, if we have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California, which means this thing is widespread. That's the good news. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work? So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. That's a significant amount of people with COVID. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. The deaths in the United States were 43,545, similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home. Millions of cases, small amount of death. Millions of cases, small amount of death.